Welcome to a Shot in the Arm podcast. My name is Yvette Raphael and I am with my co-host Ben Plumley. And where are we, Ben?
Well, that's a very good question. We are in London. We're at the offices of Paramount, where we have been at the MTV Staying Alive Foundation board.
Yes, and a quite interesting past 3 weeks, 3 days.
3 weeks, 3
3
days.
days, yes.
It feels like forever, doesn't it?
Yes, it looks like the chaos is catching up on us.
Yeah, and that's what we're talking about today. The experience of the cuts in US development aid, USAID, and of course PEPFAR, the President's Emergency Plan for AIDS Relief. I'd refer you all to the episodes I've done with Ambassador Eric Gooseby for the 38,000 foot level conversation. But what we're going to talk about today is the direct impact that both the cuts, but also this emerging trade war that is happening between the United States and the Republic of South Africa.
Is it just us or is it everybody else? I think the US is fighting with everyone else. But yeah, it's interesting times, but I think it's important that we talk about it.
So first up, tell us, if you can, directly how you have been impacted. You as a community leader, an executive director of a community-based organization, but then also as someone who benefits from services in infectious disease and mental health and all the sort of forms of care that's available in South Africa. How has that affected you?
Thanks, Ben. I think most importantly, everybody, when we started hearing about this, rushed through and spoke about how life-saving medicines, how treatment is going to stop, how testing is going to stop, including how people are not going to get funding for malaria, funding for TB, as well as some, emergency food relief. But nobody thought the extent this is going to impact on ordinary households every day, where peer educators, where volunteers, where staff actually worked for this organization, USAID and their affiliates, and how the ripple effect happened. And yeah, we're seeing a lot of, from my interest has always been these people who dedicated their lives to this work.
See, and I think a lot of Americans listening to us and looking at the news are thinking, well, how come a country like South Africa was so reliant on the US in the first place? I mean, how much funding from the US, say, through PEPFAR, the President's Emergency Plan for AIDS Relief, how much of that was going to South Africa?
It's a huge number because we have a big number of people living with HIV in the country. But also, we need to also give credit where it's due. I know nobody expects me to say this, but our government pays for 87% of our healthcare ourselves. But what that translates to then in numbers, in money-wise, it's over 7 billion. So where will we find that gap? How will we fill that gap? And that is the big thing that we are grappling with. Our country is ready, and you must also know we have a history of not only apartheid, but also denialism. And that impacted hugely on the number of people we have living with HIV in the country. But our government has been proactive by redirecting those people to the public healthcare service. Healthcare in South Africa is free. If you want luxury, actually, most of our very, very qualified doctor experts, as well as, are at Baragwana. And Bara is the biggest hospital in Johannesburg, South Africa.
And it's a public hospital.
And it's a public hospital. However, the challenge now is with just the system accepting people, but also we need to understand that there was a reason there was a gap. The gap was with stigma towards people living with HIV, people not being comfortable enough to go into local clinics where family members are nurses, healthcare workers, and doctors. Also, the stigma against, people, the LGBTQI community felt safer. people in the villages being able to access healthcare through a mobile service instead of going kilometers and kilometers in the rain, in the sun, needing money to access this. So the gap is there, and now our challenge is, how are we going to make the system come together? How are we going to reintroduce these people who accessed HIV and treatments through, mobile services and services that they felt were safe for them, especially the LGBTQI community?
So you've said something a little bit surprising, because guess what? Yvette has praised the national government of South Africa.
Yeah.
Thought I'd never hear that.
Yes, even I never thought I would say that.
But you're saying that the South African government covers for 87% of the care. Well, in which case, and just to play devil's advocate, and just so we can get this off the table, what did the remaining 13% cover, and why is it having such a deleterious effect on the country now?
Yes, like I said, systems, it helped with, healthcare workers' salary, community healthcare workers. It helped with the systems inside our government clinics. So organizations who would give HIV care to LGBTQI community would be stationed sometimes in our healthcare clinics, but because of friendliness to the service, they would then have to hire from a specific demographic that would make the service friendly to those who access it, young people, but also just nurses. There was we all want to forget, but there was a time when USAID only wanted to do health system strengthening, and that is what that was covering. The person who was giving out the ARVs, the person who's advocating and making people to come to the clinics, etc. So we are in a conundrum. It is scary, but
you're in a much better position than many other countries.
Yes, and I want to say that, because healthcare should be dependent on the country. It shouldn't be something that aid pays for. But we also understand that this aid agreements in the countries didn't just happen overnight. It was a lot of discussions.
Yeah, and that's one of the things I wanted to come back to, because an interesting component of the development, donor and recipient partner relationship between the US and South Africa was that this was actually quite a seamless fit over, 2-3 decades, 2.5 decades, I guess. South Africa and the United States essentially had a compact where increasingly South Africa would pick up the mantle as the economy and the post-apartheid democracy settled. And I guess for soft power, security reasons, and global solidarity, the US said, well, we will help you. And the sort of latest iteration, which I guess started in the 2010s, was that the US would support the salaries, the training of frontline healthcare workers, surveillance systems, potentially some support to procurement and distribution mechanisms. And then when you take that away, the system basically stops.
Yes, but we must also remember that USAID PEPFAR in the early days of denialism paid for a lot of treatment. USAID PEPFAR paid for a lot of HIV prevention PrEP in South Africa. But advocates came together we have a very strong civil society, and we came together with our government and we warned them that that is dangerous. We cannot have 100% of our treatment being paid for by USAID. We cannot have 100% of our PrEP being paid for by PEPFAR and USAID. And that is where we currently are, is that we did the groundwork to ensure that we prepare for the future.
So you prepared for the future, recognizing that the largesse of the donors and the agents of this largesse, the large nonprofits that are essentially US-based but operate in countries and operate in South Africa.
But I remember this discussion also being part of the discussion in 2012, Ben. In 2012, when we were at the AIDS conference in Washington, D.C., there were hints that, guys, PEPFAR and paying for Africa is a little bit much now.
And I guess from my perspective, the thing that has intrigued me and made the situation, I think, much worse is that while the US government rightly looks to eventually transition out, one, that transition is happening with a shudder, with a sudden stop. And so it's hard to prepare for immediate takeover of the services. But secondly, the areas where it continued to provide investment were in areas that gave it quite a lot of control. Again, the procurement and distribution mechanisms, the access to medications in the early stages through negotiations that the US government had with pharmaceutical industries and then with generics, primarily Indian generics. And I want to come back to that in a little bit. But also the surveillance. And suddenly, that has all stopped, hasn't it?
Yeah, definitely. It stopped overnight. And we unfortunately find ourselves in a situation where if this was an agreement that we negotiated, that we would stop in a year or 6 months, we would be prepared. But the intention of the extent of chaos that this government wanted to create is felt. Nobody would not have felt that. If you stop a relationship with immediate effect or whatever legal agreement you came in, there will be chaos. And many, many people are left in the dark, including people from the US.
So tell us, we're beginning to hear reports of people beginning to get sick, even people dying, because they can't access the services, whether it's their antiretrovirals or their TB medications. In the work that you do, are you beginning to see this? What sort of distress are you seeing with the people that you serve?
I think it's still early days, and these are the important times. I would not go to the extent that people are getting sick, people are dying, because that would not be really possible in a month or 2 months' time. But I think
in South Africa,
right? But I think importantly is that we start the distress. I go to my clinic, it's closed. This is all I know. Where do I go to now? And then when I go to the government clinic, there's certain documentation expected of me. If somebody's referred to a doctor, there's a letter. But because of the overnight issuing of these orders, put people in distress. So the big thing that we are seeing is some people were supposed to go get their 3 months medication. That was just a few days. In a week already they're scared. And my big issue here as somebody living with HIV myself is I know if anything disrupts my routine, it would be difficult, right, for us to get it. So people go to the clinic, it's closed. First, they need to find out what's happening. Then they go into that mode of, how am I going to get through this? And we are worried about those people that we are going to lose a lot of people into the system because it will just be way too difficult for them to move out of their routine. A lot of people who were getting the medication from these services are people who are working, in our government clinics that are already burdened. In South Africa, the healthcare system is overburdened because of, the unemployment rates. But if you think of somebody who would have to choose whether to go to work on time and go and sit half a day in a clinic, it's going to be crazy.
Do you think that the services that South Africa was looking to provide, looking forward now, like long-acting injectable antiretrovirals for PrEP, for pre-exposure prophylaxis, and there's one that everyone's talking about that's potentially offering, 2 shots a year.
Mm-hmm.
But of course, there's also our friend CAB-LA, which is 1 or 2 more shots per year. But I've heard in different countries that that's off the table now because because of these funding cuts. Do you see in South Africa a risk that these long-acting injectables for PrEP, well, and oral PrEP, to be honest, but particularly these new developments, these new innovations, do you see those as being at risk? Or do you think South Africa can somehow rally round and fund those itself?
No, our country will never be able to afford any of those medications. Let's be honest and fair. Also, as we look at things, these medicines were still in the trial phases. Even lenacapavir is nowhere near where somebody can go to a clinic and access it itself. It still has to happen in a study kind of setting, although a little bit in a reality setting. So our government has always had the fear of, even with the donations that USAID were making, was saying, we are scared that we create an expectation that we cannot feed. And we see that now with the research sites struggling to keep these drugs that are already donated in our countries. And our countries are worried, what will they do should they not be able to afford it? So there is a huge danger, but there's also an opportunity for advocacy to ensure that these become available, because these African women, these South African women, took part in these studies to make them available. So in essence, if nothing happens, rich people in the global North will access them, and the people who fought with their bodies to access them, get them, will not be able to afford to take.
Despite the promises that were made to them.
Yes, the promises, and that is where we'd also like to call on our ethics bodies in our countries to really, really find out what are the legalities around those.
If you look slightly broader beyond HIV, TB, maybe mental health as well, what are you seeing from your frontline services?
I think TB mostly is our biggest fear, is that if we don't get the right support for those services, especially funding for it, that TB is easily to become resistant. So we'll see multiple drug-resistant TB. And what can we do as a country? Because the research around TB is also so difficult that it's going to take years and years and years for us to really deal with the problems that is being created. South Africa is not a country with a huge with a malaria problem, but I think we need to understand that we advocate not only for ourselves, but for the rest of Africa and those around us. So we are hoping that solutions will happen. I know our governments are in huge talks, but some governments are just so against it.
Governments are just so against it. What do you mean by that?
Some governments do not want to invest in health. I mean, how is a government in Africa only paying for 3% of their, or 7%, less than 10% of their country's healthcare? I know in Kenya, there's no chance that that government would step it up.
And, there are international agreements or Pan-African agreements going back to the early 2000s, the Abuja Declaration, where every African country, every member of the AU, I think, African Union, committed to, I think, 15% of its annual budget going on health, or an increase, I think, by 15%.
That was one of it. But also in that declaration, the Abuja Declaration, it was clear that African countries will protect their populations. So just by not giving health care is going against that protection of your populations.
When we were at the Staying Alive Foundation board meeting this week, our South African co-chair, Stefan Glovo, told us that one of the original MTV Sugar actors in South Africa had unfortunately committed suicide recently. And it pinpointed to the huge issue of mental health facing young people in the country, but particularly boys and young men. And I know this is an issue that you have been deeply concerned about in the last few years. And I just wonder if you're seeing that, again, these broader cuts to services that we're seeing through basically the termination of broader USAID funding. Are you seeing services diminishing, retracting as a result of that?
Yes, I also think that, thanks for bringing it up, the issues around mental health and how this is not only something that impacts us as, as our jobs, as etc., but men deal with a lot of mental health issues, and may soul rest in peace. But our governments needs to do more. We need to bring in awareness to that. Programs like MTV Staying Alive play a huge role to bring about the holistic challenges of what we are dealing with as a country, as a society. And I think by not only investing it, but make in such programs, but making sure we step by step get to understand the complexities of being just alive in this world in the current state.
It gives a whole different meaning to staying alive, doesn't it?
Definitely, definitely.
Broadening out a bit, and I'm thinking of a conversation you and I had, a couple of years ago, where you told me off for talking about the importance of soft power in the donor-partner relationship. And I took that very much to heart. But one of the things that has really appealed to the security community in the United States has been that exercise of soft power, that by doing the right thing, by being seen to be doing the right thing and not making any demands, any quid pro quos, any transactional requirements, that this has forged bonds of solidarity that mean the sort of liberal world order that is largely democratically driven, that respects the rule of law and international law, that was a way of strengthening those bonds. And I think a lot of us fear that after COVID and the experience of countries in Africa being put to the end of the queue when it came to access to vaccines, that this is just the nail in the coffin of this particular form of solidarity or soft power. Are you seeing a fundamental shift in the way South Africa understands its relationship, not just with the United States, but with the countries of Europe, including the former colonizer, the United Kingdom?
Yeah, I think, and I always say this: there's nothing like aid, really. It's agreements to work together towards you getting something out and I get something out. I don't claim to understand too much of the security issues, but I want to say aid is not just aid. It's an agreement between two countries to say and it's also a guidance of us to engage respectfully towards each other. I give you something, I get something back. And I think you can see that now in South Africa, where nobody's got anything to lose. The relationship is haywire, and nobody wants to see that kind of bullying happening to your country. And this is me being patriotic, to happen to your country. But also, I think the intention of USAID PEPFAR was from good grounds. I don't think the Bush administration came up with this to, just be mean like the current president is to us.
Yeah, I mean, I think it's a fundamental shift in attitude. And I think one of the things that really pleasantly surprised me, maybe that's an understatement, was that this was bipartisan. This was left, or American left, which is basically right of center, and right, absolutely right of center, alignment on the importance of foreign aid. And in this instance, it was HIV, and that we could come together and deal with the first of the sort of global pandemics happening around the world, this sort of new era of globalized epidemics that start in one part of the world, spread rapidly to many other parts. And that was something to be proud of. That has gone. And as you look forward, how do you see How do you see South Africa surviving this? How does it, no, not only survive, but how does it thrive?
I think South Africa is in that better position that it is able to take care of its own citizens, Ben. And going forward, it may not be a bad idea for us to go back to the negotiation tables to talk, but how do you speak then to Donald Trump? Have you tried?
Have I tried? See, where I was going to go with this was to say, Yvette, you have the floor. What would you say to, well, in the first instance, Peter Morocco, who's the interim deputy director of USAID, but yeah, up to Secretary Marco Rubio and Donald Trump. What would you say to them without us having to put an explicit guideline in the show notes?
Okay, it's what happened. Who made you mad? Why are you so angry? Why the hate? Why the total disrespect of legal documents, legal relationships? What made you angry? It's not the time for revenge. We know it was painful. We know you were hurt, but this is not the time for revenge. And you don't take it out on the normal citizens of a country.
Yeah, people
or your own country.
Yeah.
And of the poor.
Yeah.
I mean, I read of some voters who regret voting for the current dispensation because they didn't think this will affect them, or they didn't think the extent of how far this would go.
You know, another thing that has come up in conversations that we've had with friends and colleagues working in different countries in Africa is that there is a respect for Donald Trump in many parts of their governments and it's not even grudging, that it is, you know, the United States finally has a strong man that speaks up for the US agenda, and this is someone we can do business with because we understand the transactional nature of what he's trying to do. How do you respond to that?
I don't think governments need to respond on a business relationship. This is not business. Governments are supposed to take care of their people. Presidents are respected for their nature. The presidents are expected for being empathetic with other countries that are going through stuff. It's nothing about business. And this is why we see the South African running amok, because they think there is nothing like government wastage and spending and hiring federal staff. It is crazy that we have to go through this, but take me out of my misery and let's go to parting shots.
No, because
this won't end well.
No, it won't end well. And there's one more elephant in the room.
Yes.
A businessman, South African by birth, Canadian by citizenship, who sort of kind of got into the United States, maybe legally, maybe not, who is totally
and racist by nature. Why are you leaving that?
I haven't got to that bit yet, because I wanted to come on to this extraordinary situation where Donald Trump is asking the Immigration Service to prioritize the poor white Afrikaners of South Africa.
That makes me so angry, because South Africa has always worked on our rainbow nation, the legacy of Nelson Mandela. We do this together. We don't push too hard. And somehow I think the racists who stayed in South Africa, they worked on continuing being racist. And those who were out of South Africa were bitter and continued that legacy of racism. And I was on a plane once, and when I came back, I told my kids, I like, do you know racists are racisting outside other countries? And my daughter asked me, Mama, how? I'm like, I was on a train in Lima, and Afrikaner people were being racist to the people of Lima. And they were specifically using vulgar words. And I turned around because my activism doesn't allow me to keep quiet. I said, these people are hosting you in their country and you are calling them exact same names you called Black Africans when you left. Nothing has changed. So including Elon, he left South Africa because he couldn't stand the Black power, the Black in rule. But also more than that, he hated it and he wanted to, this is a revenge moment. When I say who hurt you, I mean exactly like this. These people are very hurt. Elon is bitter. He has not even come to speak to us as a country about Starlink, Warlink, whatever it is. But he knows he doesn't stand a chance unless Black people are empowered. And that is the rules of our country. And we have to understand that the racists continued the work. We were just being very happy on the surface while people continued the work. I mean, we have Orania, which is a piece of South Africa that just belongs to white people.
Yeah. So my observation on this is, like many privileged white people in the United Kingdom, I went to private school, public school, very similar to the kind of public schools that Elon Musk and Peter Thiel and some of the others who are around the Trump administration went to in South Africa. The South African public schools copied ours. But we actually had white South Africans, friends and family who were at school with, and I was at school with. And two really major things struck me. One was they were leaving because of the violence, not because they were opposed to apartheid. And their parents were sending them to these schools precisely to protect them, to keep them in a bubble, rather than challenging the appalling status quo that was then. And then the second observation is that, of course, a lot of people left South Africa then because they didn't want to do military service. And it was not a question of them being opposed to apartheid. It was simply, it was the white South African equivalent of Donald Trump having bone spurs. And so your point about this worldview from the 1950s to the 1990s, South Africa is alive and well. It's alive and well in Silicon Valley, and it's alive and well in Washington.
Definitely.
Okay, let's go to parting shots. I mean, I really feel we ought to say something upbeat and positive.
Yeah.
What's keeping you sane at the moment, besides my company?
Ben, thank you. I think what's keeping me sane is thinking about the future and that I cannot let this weaken my fight, weaken me, but use this moment of chaos to seek opportunity.
And I got to say, my moment of optimism is seeing people like you in South Africa, in Kenya and Nigeria, in Malawi, Rwanda, Zimbabwe, Botswana, standing up and saying, this is our opportunity. Okay, we wouldn't have necessarily wanted this to happen this way, but now's the time that we call the shots. It's our epidemic. It's our healthcare.
Yeah.
So that's a nice way for us to end, eh?
Yes, and thanks for this great conversation. And we can...
I'll see you soon.
Yes.
Well, that's it for this episode. Thank you very much to Yvette for giving up an hour of her time to share the state of affairs as she sees it in South Africa. I was the director and producer of this episode, and Eric Espera, our overall director and producer, is going to kill the both of us because you just knocked over your water cup. So yeah, Eric, our executive producer and director. And of course, a big thanks to you. You can find us wherever you download your podcasts. We're encouraging people to come and see us on our YouTube channel. So if you get a moment, please do go there and encourage your friends and family to join us there. Well, with that, Have a great week and a safe week, everyone.
Thank you.